what we're seeking right now, we currently have a case manager position open. It's been open since early March, and we're requesting permission to fill this promotionally from one of our positions known as community service assistant. It would be an upgrade. And we're also at the same time asking that we create and fill a second case manager position, which would also be filled from an upgrade from the other community service assistant position. By doing all of this, it's still, I know it may look like two new positions, but it really isn't. It's two positions taking the place of three. And we'll end up saving the county, I think it was $30,000 or $20,000, $23,000. 20, right. And at the same time, we wouldn't have to refill one of these positions from the outside, and we would save on benefits money also.
Okay.
Any questions for Kevin?
I mean, our caseloads are going through the roof.
And,
pardon me?
Kevin and I met last week with Ken, and this is in the 2021 budget with the positions and the savings of $23,000. So it's we've budgeted that for 2021 so far.
Okay.
I wasn't invited, so I'm not part of it.
Okay. I think I'm good.
Yeah, I don't think I'll.
All right.
Can everybody mute their devices? Sorry. Just makes it clearer for everybody.
Okay, so Kevin, any questions for Kevin?
Pardon me? We froze or something.
No, I said any questions for Kevin?
No.
Okay, so we would need a motion.
I'll make that motion.
I'll second it.
Second, Ron Knott. Any discussion? All in favor?
Aye.
Aye.
Opposed? Carried. So mind you, it's a almost $23,500 savings. So thanks, Kevin.
Okay, thank you, Matt, and the rest of the board. I also just wanted to give you an update. I know we had been talking before about upgrading an existing position, a different position to handle our heap responsibilities, which has never ended this year. I will be coming back at some stage with that. Right now, we've run into a little bit of a problem as to a proper title and proper grade, which I'll be working on with both civil service and with HR in the near future. So I just wanted to bring, if anybody is questioning where that went to, we pulled that before it got on. So.
Okay, thanks.
Okay, that's it.
Thank you.
Okay,
Thank you.
Next on the agenda is authorization to fill a vacated deputy treasurer position due to retirement. I'll turn that over to PJ Keeler.
All right, thanks, Chairman. Basically, I'll give you the Cliff Note version. What I want to do is take 3 positions and consolidate them into 2, and I want to leave a bookkeeper position open. Tommy Dawes is retiring here. This is his last week. He's the deputy treasurer. Want to take the accounting systems monitor position, move it into the deputy treasurer position, then move, you'll see the next one, is move a bookkeeper into the accounting systems monitor position. And the overall savings by doing this and by leaving a bookkeeper position open be about $64,000.
Okay.
Okay. Good.
And it fills all your operational needs, PJ, in your office?
So far, I mean, we're going to try this. We'll give it a shot. We'll leave a bookkeeper position open for now and see how it goes.
So if you had to fill that bookkeeper position, what is that, around 60,000? Is that what that?
No, it's 40, early 40s. Now with benefits, it's up around 60.
Okay.
So, and again, that would be in phase 2 of the next reorganization.
Okay.
Any questions for PJ? Okay, I need a motion. Motion on the
I'll make that motion.
motion, Jim Guzzi, second.
I'll second it, Art Basson.
Thanks, Art. Any discussion?
Matt, are you doing both resolutions with, they voted on both?
Yeah, we might, will you make that motion for both resolutions, Jim?
Yes.
And Art, you'll second both of them?
Yes.
Okay. So, any discussion? All in favor?
Aye.
Aye.
So far, we're doing good. We're saving like $80,000 so far.
This is a big one right here.
All right, next is, Health Department, Jack Mab. Authorization to create and fill one registered nurse funded through New York State DOH epidemiology and laboratory capacity for infectious disease grant.
Okay. All right, so you can hear me?
Yep,
Okay, great. So the state is handing down $133,000 a year in order to enhance our ability to do contact tracing and or other things. One of the hooks is that we have to do the ComCare system, which are one of 6 counties in a region that are not currently doing it. But our feeling is that if we're able to hire somebody to actually manage ComCare, which is what this position would be, they can also help with the contact tracing and work with our positives as well. So what we want to do is hire a nurse to do that. It doesn't bring any additional monies to the county. Again, $133,000. We set up a separate resolution to also hire a part-time data clerk to support this person through this grant. So this brings a brand new nursing position into the county, and it doesn't cost us anything. So yeah, here's the other resolution. They're kind of connected. Data clerk would help put the data into ComCare. And then we would also like to backfill the clerk typist. We have somebody in mind for the part-time data clerk, backfill the clerk typist position that she's currently in. It's an existing position because we are being told by State Health Department, we're being asked to ramp up our efforts to do mass flu vaccination pods, point of distributions, in preparation to be able to do mass vaccine on the COVID vaccine. And so in order to register people for the upcoming flu pods, because we have to collect insurance, that's a big task. That's a big part of the task. We want to do that. So the net on all of this is there's no cost to the county. We're going to add a position and a half and backfill an existing position.
Jack, when this 2-year grant is over, how do we fund the nurse's position?
We have a nurse who is retiring in 2 years. The timing is pretty much perfect. And I guess I'm hoping I can bring in some fresh blood. Truthfully, a lot of my nurses are just slightly younger than me. So I'm hoping that through this, we could actually bring in a new nurse. We did have somebody who we interviewed in this last go round when we hired Maria, who was great. She was 35 and whatever. And I understand that she has good computer skills. She may be perfect for the job. We're going to canvass nonetheless. But I actually have up to 3 retirements of nurses in the next 2 years. And one definitive is Liz. So we're going to be able to just slide her right into a county position and not have to pick up a position that we don't want to do.
Okay. Thank you. Any questions for Jack?
Yes, I do. This is Becky in Civil Service. Jack, I just wanted to confirm, are you going to hire the public health nurse or the registered professional nurse?
Well, you and I decided to go the route of a registered nurse.
Okay, so because maybe this is just the old resolution request, public health nurse, but is the registered professional nurse non-competitive?
We sent up a new resolution this morning.
The one on the screen says registered nurse. That's the correct one, right?
Yeah, we're going to hire a registered nurse.
Okay, all right. I just wanted to confirm that.
Okay.
Thanks.
So any other questions for Jack?
I just wanted to point out and make sure that there wasn't a misunderstanding that that age isn't a factor in how we're hiring people.
No, it's not.
Right. I just wanted to make sure there's not a misunderstanding. Just wanted to put it out
Well,
there.
I think it's not about the age, it's about the length of time between when you hire them and they're gonna leave you. You know, so if, you know, it's, yeah, I think the average age right now of people in public health across the state is 57. That's pretty scary. That means a lot of young blood coming in all at once, a lot of inexperience coming in all at once. But no, age is not a factor. Matt wouldn't have hired me if it was.
Any other questions?
Are we voting on the two of these together again?
Yeah, we'll vote
Okay.
on it together, so I would entertain a motion for both resolutions.
I'll make a motion to approve both resolutions.
Ron Knott. We need a second?
I'll second it, Art Basson.
Second, Art Basson. Thank you, Art. All in favor?
Aye.
Aye.
Opposed?
Thank you.
Carried. Thanks, Jack. Is Rob Begonia on the call? Nope, okay.
I don't see him.
All right.
Yes.
Oh, there you are, Rob.
Oh, there he is.
So Dan, I think you're up.
Yes, thank you, Matt. Chairman Morrell, I appreciate it. Kelly, if you could just tell me which one we're looking at, because it's very, very small on my screen, and then I can switch to the resolutions that I have on a different tile and be able to speak to them.
Okay, the first one that's up is authorization for Department of Human Services to abolish one full-time psychiatric social worker grade 19B and create and fill either a 1.0 senior behavioral health social worker.
Okay, thank you. So this resolution speaks to the need within the Columbia County Mental Health Center specifically. As some of you may know, we've had a substantial amount of retirement as well as resignations. We currently have 4 what were previously known as psychiatric social worker positions vacant. So what we're hoping to do is just ask that one of them be allowed to be converted. So we're going to phase it out. And we'd like to fill it with either what's called a senior behavioral health social worker or a behavioral health social worker. And the reason that both of them are listed as an either or is because the senior behavioral health social worker has the advantage of carrying a requirement for a licensed clinical social worker. What that means for us at the mental health center is that allows us to get reimbursed by certain insurance companies. Some insurance companies that we work with require the therapist to have the LC certification. The tricky part about that is it's difficult to find those individuals when we're recruiting for a vacancy that requires an LCSW. So in case we're not able to find such a candidate, we would like the option to go for the lower grade position, which is the behavioral health social worker. And those are individuals that just have a licensed master social work degree. And they are reimbursable for the most part, but as I said a moment ago, some insurance companies do not accept them. But we'd like to see what an inquiry would yield as far as our recruiting efforts go. But the department is very much in need of filling a vacancy at this point. We have a wait list of 60+ clients. There are obligations to community providers, such as Columbia Green Community College, that we're not able to meet because of the vacancies that we have. Our clinicians currently are carrying caseloads in excess of, in some cases, 90+ cases. So we're asking for the support of filling one of these, either a behavioral health social worker or the senior behavioral health social worker position.
Okay. Dan, is there another resolution?
Yes, there's one more, sorry. This resolution speaks to backfilling behavioral health care coordinator vacancy. That's a different program from the clinic, but we're backfilling an employee from the care coordination program, has already been accepted in the clinic and will be moving over, but cannot move over until the program director is able to backfill her. So we're asking that for this backfill to be approved so that she can be moved over into the clinic. And there's no cost there because prior to COVID-19, she was moved over and is being paid the behavioral health social worker salary.
Okay. You had talked to Rob and I Dan, about the potential revenue from these three people or two people?
Yes. So the revenue, right, between backfilling the behavioral health care coordinator and which would allow the employee to move from the care coordination program to the clinic, plus hiring either a behavioral health social worker or the senior behavioral health social worker, one or the other, would generate in the remaining 3 months, and I say 3 months of 2020 because if this were supported, even as of today, it would take time to onboard, to train, et cetera. So I'm figuring pretty much October, November, and December, we're looking at a potential capturing revenue of upwards of $60,000.
Which, based on their 3-month salaries, would exceed both
Yes.
of the 3-month salaries.
Yes, the combined expense of the 3-month salaries for all three of the positions, this would exceed that, yes.
Okay. Rob Lagonia, do you have anything to add?
Just that we've worked pretty hard with Dan and obviously yourself, Matt, and it's definitely a need. The health department, the mental health department, is short numerous positions. Dan has graciously taken on the interim position, and I think it's imperative that we give him these 2 positions filled. It'll jumpstart him, and it'll help the mental health department. And obviously, there's a need in the community, so I definitely support this. Yes, thank you.
Any questions for Dan?
I would like to thank Dan for the thorough explanation, and I would make a motion to approve both of those.
I'll second it.
Thank you very much, gentlemen. Appreciate it.
Any discussion? All in favor?
Aye.
Aye.
Carried. Thank you. Thanks, Dan.
Thank you. Have a good afternoon.
Yep. Okay. Ron Knott, you're on.
Okay, this is,
Brian's on too.
oh,
Brian,
Brian's on. Okay, I'll let Brian handle it. You right there, Brian?
is he there?
Yes, I'm here.
Okay.
Did you talk about this position, Brian?
This is for the courthouse position?
Correct.
Brian, go ahead and explain what it is, hon, what you're doing.
All right. Recently, we just had he was a per diem employee. I don't know if everyone knew him, Turtle, retired. And so we were in a good situation where I was like, we could probably get by without filling the position. But just recently, with the courts being open, they came and asked, they want almost after every little hearing or situation they have that's done in place, they want the guys to go in and clean before the next person. And I have 2 daytime employees there, and they're doing a good job with it, but we're going to need that additional person to carry them out to help through that day, because if the guys being furloughed, each of them one day during that, who knows? Luckily, we're on Mondays and Fridays where they're really slow days, but it's going to be hard to keep up with the demand that they have. But the good thing is that it's fully reimbursable by the state, and it's going to be at a lesser rate. So it's going to be like just under $3 less an hour, with instead of 6 hours going to 5 hours. So the county will be saving money this year because the budget amount was already just like $29,500, and we're going to come in well under that. So that's the situation we have with that. That's why I figure we should get the ball moving and hire somebody, because the guys are, pretty busy over there in between each court. When they have multiple courts, it's tough for them to stay on everything. So that's why we're asking to refill this position.
I'll move that, Matt.
All right. We have a motion by Jim Guzzi.
I'll second it.
I've got a question.
Is that Sarah Sterling second? Oh, you have a question, I'm sorry.
He's got a
Sarah.
question.
Yeah.
Yeah.
So we're hiring somebody because the other people are furloughed. It doesn't make
No,
much sense.
No, we're hiring somebody because somebody retired. But it's been hard to keep up with the schedule with the furlough, with the guy being short, but we've already been short for 2 months here.
Okay.
and now that court's starting back up again, they're gonna be a lot busier because there's a lot more cleaning, correct, Brian, in terms of?
Yes, that's what they're asking for. In between every, quick, no matter like a little, not really trial, but anything that goes in front of a judge when multiple people change places, they want the areas where everyone's been at, the attorneys and clients, disinfected, and they let them know in between each case. So it's like they work, but it's like they got to almost be on beck and call for some of these when there's heavy court days. So it's tough doing the maintenance there also. So that's why if we have this other employee back, then he can help. He can be the one staying basically on call when they switch cases in between cases. Would help out a lot.
But Brian, this turtle's been there a long time, so even before COVID. So he was doing, what was he doing prior? He was doing cleaning work and everything prior, correct?
Yes, but he was towards the beginning or like midway of the COVID when they really shut down everything. I was asked by the judges just to let him stay idle because of, how do I want to put it? So we didn't really bring him back so much because there was no court at the time. But leading up to it, he didn't feel comfortable coming back, and the judges were, so he opted to retire. But no, he was doing cleaning and plus doing a lot of the, errands for the judges and stuff there, which I'm slowly getting that away from. So this guy's going to be there to clean. That's the way I want to put it. So.
Yeah, and for the minutes, Turtle's actual name is Carmen Torsia. So people might read the minutes and say Turtle.
Turtle.
All right, any other questions? So we have a motion. Can we have a second?
I'll second it. Well, I made the motion.
You made the motion. Ron, not?
I will second it.
Art Bassett, second it. Any discussion? All in favor?
Aye.
Opposed? Carried. And again, this is 100% reimbursable.
And we got by 2 months without having the position, so.
Next, now it's on you, Ron. It's the Highway Department part-time labor.
Okay, yeah, we need to refill a part-time laborer. This is a night watchman position at the Columbia County Highway. We discussed this at our committee meeting here last month. I wanted to bring it through this committee. The night watchman is a position that when there's not staff in the building, we have the building staff so that they can watch the different vehicles that come in for fueling. They're also there to dispatch calls when people need help from the highway department. They can call the foreman on duty. It is a position that we considered trying to do away with, but it saves too much money to have this position. And this is a pool of people that we have for these, and you need to have enough bodies to cover the hours because somebody needs to be there whenever we don't have staff there. And we're also saving $2 an hour by in a step, going back to a step position. Right, $2.60.
Any questions?
Questions?
I'll make a motion.
Motion, Jim Guzzi.
I'll second it.
Second, Ron Knott. All in favor?
Aye.
Aye.
Opposed? Carried. Go ahead. You again, Ron.
No, Jolene is on.
Oh, I'm
Jolene's done. I'll let Jolene go through this one then.
Okay, good afternoon, everyone. I'm asking to fill a part-time labor position. We had one of our employees resign last week, so it's utilized at all the stations as we are pretty much bare minimum right now. The position is needed.
And they'd be working at all the stations, you said?
Yes, yes. This position was primarily at the Kinderhook and Chatham stations.
Okay.
I'll make a motion to approve.
I'll second it.
Any discussion? The only thing I'll say in discussion is that solid waste is one of our departments that were deemed by the governor and us as being essential because we do still have to take care of our garbage, whether we were in a quarantine or shelter in place time. But so they in doing that, they all had to work, and there is a need, to continue to keep our stations operating.
And Matt, I'd like to add that not only are we maintaining operations, but because the population of Columbia County is much higher than it normally is, our solid waste collection is up big time. Jolene can speak to the facts and figures, but I think in June, we normally average 30 truckloads, and this year in June, we did 52. Is that right, Jolene?
That is correct. It's been a very busy time.
Okay, yeah, well. So do we have a motion and a second, Kelly?
Yes, we do.
All right. All in favor?
Aye.
Aye.
Opposed? Carried.
Thank you.
Thank you.
Yep.
The sheriff is next. Sheriff Bartlett.
Good afternoon, everyone. My first request is request authorization to fill and also to fill any vacancies from filling this captain's position. The captain of the law enforcement division is retiring. It's going to be a vacant and budgeted position.
And the captain has to be filled, Sheriff, based on
Yes,
your
sir.
chain of
Absolutely. It's a division commander. They oversee the entire division.
Okay. Would that be an internal promotion?
Yes, sir.
Okay, any questions? So,
Want to go to the second one?
Yeah, do the second one as well.
I'm requesting that we take 2 per diem deputies and change their title to part-time deputy sheriff's position. Basically allows me to utilize them instead of 720 hours a year, 1,040 hours a year. These deputy sheriffs would have civil service competitive rights, and basically they'll help us out in these security services divisions. I can't use them for regular patrol above and beyond minimum staffing. We could use them on some details here or there, but it helps us out where we can plug them into spots like the courthouse and DSS.
So, Sheriff, could you explain, once your per diem deputies reach 720 hours, how do you cover those shifts?
Overtime.
With full-time deputies?
Yes, sir.
Okay. So this is saving us money?
Yes, sir.
Okay, any questions for the sheriff on both of these?
Yeah, I have a question. As you know, Sheriff, hi, how's it going?
Good.
As you know, we've been getting a lot of questions sort of around our public safety budget and around the sheriff budget. It makes sense that we have a chain of command and we need to that needs to get structured the right way. And also the second resolution, it's kind of getting the same coverage. But I anticipate I'm gonna get a lot of questions around, okay, we can hire the chain of command, but do we need to backfill that? And sort of like, what's the public benefit of backfilling that position? And I guess I'd like to hear what you would say to people.
We have the minimum staffing. When we run our shifts, there's nothing above and beyond what we do as far as minimum staffing. If I've got 4 deputies out today and that's minimum staffing, I don't put 6 out and the other 2 are on overtime. It's always the bare minimum. And if we don't start filling positions, like in this case, it's going to cost overtime.
Right.
Would we, Sheriff, we went through this with the lieutenant's position.
Yes, sir.
If we did not fill it, for example, one of the sergeants would have had to take responsibility and would have been paid out of title pay.
Yes, sir.
And then, so in this case, if you don't fill the captain's position, whoever does do those responsibilities would get out of title pay as well?
Yes, sir.
Okay, then you'd have to backfill. It's sort of a chain reaction down the line, so.
It is a chain reaction all the way down. And then ultimately, if you're not filling the deputy sheriff's position, when it comes to filling those spots on the road that are minimum staffed, then you got to cover it with the OT.
And then how do we determine what is minimum staffing? Is that in the union contract, or that's just based on sort of assessment?
It's contractual.
Okay.
And the working out of title is contractual as well, so.
Right.
Yes, sir.
Okay, thank you.
You're welcome.
So I would entertain a motion for both of these resolutions.
I'll move both of the resolutions.
An issue, just a quick thing here. This is Becky again with Civil Service. Just for these employees are gonna have to go through physical fitness exams, like any other employee that we hire off of this deputy sheriff list. They cost about $500 a pop. And then after our budgets were cut, I don't have enough to cover that necessarily. I don't know if that's something we can work with the controller's office on to look at, but I am going to go in the red if we're going to be conducting many more of these.
I can probably pull that, Becky, from my account to help
Is
you
that
out.
okay? So maybe I know I have enough left to cover one for one employee. They have to go through 2 different fitness tests, but if you can cover the other, then that would be
Yeah,
fine.
Not that I have extra money either, but I'll cover that, absolutely.
Okay. All right. Thank you.
Yep.
Okay, thank you, Becky. All right, so we need a motion and a second.
I made a motion to approve both of them. Ron, that.
Yeah,
All right.
Ron made the motion. We just need a second.
Second,
I'll make the second, Art Basson.
thank you, Art. Discussion? All in favor?
Aye.
Aye.
Opposed? Carried.
Thank you, everyone.
Thank you, Sheriff. Is that it, Kelly?
That's it for the agenda, Chairman, unless you had something else to discuss.
No, I have nothing else.
Can I just ask a question?
Sure.
Ron and I are going to be meeting tomorrow on my budget. And we're also going to be talking about the position I raised last week of creating an accounting position for the health department. Is that something that we're just going to wait till the next month to do?
Yes.
I do have somebody working out of title. So is that, did you say yes, Chairman?
Yes, I did.
Okay. I just wanted that clarity. That's all.
Okay.
Thank you.
Try to slow your spending down, Jack.
Why? I'm on a roll, man. 266 thou, you know? No, I'm trying to save money. I'm trying to get efficiencies here. Come on.
There you are. All right, well, if there's no other somebody make a motion to adjourn.
Motion.
Motion, Jim Guzzi,
Second.
second, Ron Knott. All in favor?
Aye.
Opposed? Thank you all.
Thank you.
Okay, take care.